The global race to find a vaccine for coronavirus may see a breakthrough by September. The human trial of the Oxford vaccine, one among the many vaccines being developed across the world, started last week. Serum estimates the price at ₹1,000 for the vaccine. Oxford has an accelerated timeline as it had a head start on the vaccine.
Whooping cough starts with most kids like a common cold. The baby that gets it will then, after several days to 2 weeks, start coughing so hard that they're throwing up, that they're getting blue around the lips or blue in the whole face, not able to catch their breath. That's when it's getting dangerous.
Whooping cough is an acute respiratory disease that is caused by the bacterium Bordetella pertussis. Whooping cough is highly contagious. It can be spread by airborne droplets containing the bacteria, which are expelled during coughing or sneezing. The bacterial droplets can then be ingested by another person, spreading the infection. The bacteria infect the airways and damage epithelial cells.
Health officials say children should be vaccinated or the country risks bringing back many rare diseases. But in California, a growing number of parents are saying no. Bill Whitaker met one of them.
Who knows what color we're missing?
Purple. Green.
3 years ago, Dottie Hagmeyer began making healthier food choices for her family. She also made a crucial decision about vaccines.
I feel like there's no reason at all for me to continue to vaccinate my children.
But Hagmeyer worries about the vaccine's potential side effects.
Do you think the risk of taking the vaccine is greater than the benefit?
I personally do, yes. Even if I get my kids vaccinated, they're still at risk to get the whooping cough.
Even though the CDC says the vaccine protects 7 out of 10 children from whooping cough, a growing number of parents in California, most of them affluent and educated, are signing waivers refusing to vaccinate their children, and that's alarming health officials.
You opted out of vaccinating your son, who is now 14 years old. You stopped vaccinating him after his 6-month mark. Why did you do that?
I did that because of my older son's vaccine reactions that he had as an infant. My son, I took him in for a hepatitis B vaccine. He immediately developed a hideous diarrhea. Later that night, developed a fever, arched his back, screamed. If I would have known as a young mother these were signs of encephalopathy, brain swelling, I would have known to get him to a doctor right away. But after that evening, his health deteriorated for the next 2 years, and at 2 years and 9 months, he was diagnosed with autism. We didn't put the pieces of the puzzle together until I had my second son, who also started exhibiting some strange vaccine reactions. And at that point, I had to really weigh the options, and my husband and I decided that our children's neurodevelopment was more important than vaccinating for these diseases.
One of the reasons we have a complete healthcare system failure is because there is a root of an epidemic of misinformed doctors and misinformed patients. And that stems from biased funding of research. That's research that's funded because it's likely to be profitable, not beneficial for patients. I'm Dr. Asim Malhotra. I'm a consultant cardiologist and author of The POP Diet. So a few weeks ago, I was invited to speak at the European Parliament by MEP Nathan Gill for Wales, and the topic of of discussion was big food and big pharma killing for profit, ? And the real issue was to discuss, to get to the root of why we have a major healthcare crisis across the world, specifically in the UK and Europe, but certainly relevant to other places as well. And essentially, the main focus was the fact that on one level, we have an obesity epidemic and an epidemic of chronic disease, which is causing great havoc on the healthcare system. But also intertwined with that is the fact we're over-medicating millions of people with drugs that are not going to give them any benefit whatsoever and only give them side effects. So really, we need to shift that balance away. And one of the key themes of the talk was that we really need a campaign over the next few years now to reduce the amount of medications people are taking because it's causing considerable harm, but also simultaneously promote lifestyle medicine prescriptions using the best available evidence so that we can empower both doctors and patients to improve people's health very quickly through lifestyle changes and improve their quality of life. And if we do that, then our healthcare systems will get better, our populations will get healthier, our economies will be more productive. So really, it's a win-win for everybody. When one looks at the totality of the evidence with research, certainly from the pharmaceutical company side, on top of that, when you look at the behavior of the pharmaceutical industry, who we must understand they have a fiduciary obligation to make profit for their shareholders, not necessarily to give you the best treatment. In fact, that isn't a legal obligation for them. Most of the new drugs that they've produced in the last decade or so have essentially been copies of old ones. So they patent these drugs, they make lots of money off them, but they're no better than old drugs. But also they engage in criminal activity. So there's very good evidence that shows that most of the top 10 pharmaceutical industries have engaged in corporate crime. So basically, between 2009 and 2014, the combined costs of fraud from most of the top 10 pharmaceutical companies is close to $14 billion. And that's for illegal marketing of drugs, hiding data on harms, misrepresenting research results. So this is really quite extraordinary. So we have an industry that clearly is out of control. And what happens with all of the research information that is biased is that we as doctors are then having to make clinical decisions on biased information. So that isn't going to just lead to poor outcomes for our patients, but it's also unethical. So what we need really is a revolution, essentially, where we can have more transparency in the system, remove commercial conflicts of interest from guideline boards that make decisions that then doctors, prescribe drugs on to patients, and also have a more honest discussion with patients, more transparent conversation with patients about many drugs that are prescribed so that they know that actually the majority of them are not going to benefit. The question is, what is that true benefit for an individual, and then let them make an informed decision. We call that shared decision making, and that's much more ethical. At the same time, we have a food industry that profits from obviously selling food, but the regulations are so weak that people are misled. So foods are allowed to be marketed as healthy when they can be loaded with lots of sugar, like low-fat foods, for example, that will cause you more harm. So really, across the board, we are dealing with an epidemic of a misinformed population that's damaging people's health. So there's also a question about whether this is democratic, especially when there is a deliberate withholding of information, when industries engage in tactics where they silence whistleblowers who have information about a drug, for example, that may not be as effective that's being portrayed, or people that want to speak out within academic institutions that are aware of research misconduct and fraud going on. And we know that's a big problem in British institutions. And it's not being reported because I think people are scared. So really, what really needs to happen, and what came out in the talk I gave in the European Parliament with a number of other doctors as well, is that really we called for an inquiry, similar to what happened in the UK when there was an inquiry into the Iraq War. We called it the Chilcot Inquiry. We need that sort of inquiry to really help resolve and revolutionize the system, because finance has trumped healthcare at every level of the system, whether it's the quality of the research, the way it's funded, medical journals and their reliance on pharmaceutical industry funding, journal editors getting high salaries, a lot of it being funded by the pharmaceutical industry, medical education that's being captured by the industry as well, and it biases the information that's being given, medical training. The information that's relayed between doctor and patient, financial incentives to prescribe drugs, for example. That shouldn't really be there. There should be a financial incentive to have an informed discussion with a patient. So that we have the solutions, but we have to put them into practice. And there are many powerful vested interests that are going to oppose that because they profit from this old system. But the old system is causing tremendous harm to our patients and our population. I think there has to be an inquiry. I think we learned from history that any revolution happened because there was media attention and there was sunlight. And in this, we have malodorous health policy. Sunlight is going to be the most powerful disinfectant. And that has to happen with a full public inquiry so everybody knows what's going on. And if everybody knows, it becomes much harder for people to be misled. So when I walk into a coffee shop and the person who's serving me coffee is aware that much of the clinical research that's published in medicine cannot be reliably trusted at the moment and really needs to have a healthy skepticism about it, or the taxi driver talks to me about this, then I know we can win this battle. So statins have been one of the most prescribed drugs in the history of medicine over the last 3 decades. And they were prescribed on the basis that there was a belief that tackling and lowering cholesterol as much as possible would eradicate heart disease, which it hasn't. It's had, in population studies, really it's had very little, if any, impact. Even with people with heart disease, that's because many patients, even who have heart attacks, stop statins within a couple of years, and they cite side effects as being the reason. I think there is a role of statins, but I think it needs to be much smaller than at the moment. I think we have over-medicated millions of people on statins. But the key thing is giving information to that individual patient based upon the data that's there to tell them what that true benefit is, and that benefit is very small. And to not do that, we're selling our patients short. And the other thing is it gives many people the illusion of protection. They think if they're taking a statin and they're controlling a lab number, their cholesterol levels, then that means everything's fine and they can eat junk food. And in fact, actually, that can be very harmful. So there could be in fact, there is a net harm, in my view, in giving statins to healthy people, especially if those people are following unhealthy lifestyles. For me, the health misinformation mess is a gross injustice that's going on, being perpetrated on doctors and patients throughout the world. I know from various parties who were aware of the talk and saw clips of it and congratulated me. So it's actually making as many people aware, but also the powerful, the influential people. But I think also we need to think about the fact that actually our individual happiness, I believe, is dependent on our collective happiness. We don't live in cocoons. And actually, if people in our society are feeling that they are being treated unjustly, or if they're unhealthy, and they're ill and they're sick, they're going to be miserable. And that actually affects all of us. So we have a duty to our community to help our communities as well. And that's just also my oath, my duty as a doctor is to look after my patients, to protect scientific integrity. So I'm doing what I can to uphold that oath with all the work I do. But thinking broadly, if we all act together and help each other, then we as individuals also flourish and benefit.
Take a chances and get a coronavirus better than shutting down this economy.
I'll die on my feet, not on my knees.
Yeah, I want you to take the vaccine first, Bill Gates.
We don't have a civil right to be immortal. If only the healthy people are okay and the people who are at risk get ill, isn't that how it's supposed to be?
There's not enough police to stop this. That's why everybody, 60,000 people went to the beach yesterday. You can't stop this. You're a minority.
COVID-19 is nothing more than a common cold. Everybody better watch out. Don't take your vaccine. Don't take nothing.